Hello, hello, hello. Happy Sunday. Welcome to the Insaka Talk Show. My name is Irene White, all the way from Chicago. It's really, really cold today. I think any of you that knows anything about Chicago, you know where I'm coming from. With me, I have my beautiful co-host, Miss Winnie Musonda, all the way from New Jersey.
Good morning. It's cold over here, raining. Ugh, but it's good. Happy Sunday.
Happy Sunday to you too. We have a very packed show today, and I hope you guys can stay glued to the TV, to your screens, to your phones, whatever device you're using, because today is going to be a learning lesson. The topic is the HIV/AIDS epidemic and the advancements that we are having as today. Um, we are going to have a co-host today who is a friend to the show. Miss Nelly is not around. She's going to produce, and Miss Priska is not feeling too well today. So we're going to have a co-host. All the way from Indianapolis, we have Mr. Noah Ndhlovu.
Hi, Mr. Noah.
Hello,
Hi, Mr.
listeners,
Noah.
viewers. Yeah, it's good to be part of the show. I'm just happy to be here.
That's good. Thank you so much. Thank you so much. How is the weather in Indianapolis?
The great state of Indiana, it's cold like Illinois, cold weather.
I'm telling you, it's we've been drinking hot chocolate since morning. Anyway, so before we dive into the very needed topic, we're gonna go to the icebreaker questions just to enlighten our brains. Um, so we have if money and time were no object, what you do be doing right now, Mr. Noah? If money was no object.
Oh, I'll be relaxing in Zambia.
Why did I not guess that? You've been
I'll,
relaxing in Zambia
oh yeah, I will
with
be
no money.
sitting comfortably. Money makes the world go round, but I think also the environment in which you are in. Because when you're in Zambia, surrounded by friends, relatives, I think it's more pricier than money.
Yep.
All right. What about you, Miss Winnie?
I think
What
I
you
would do the same thing. I'll be somewhere in the village. Kumushi, today, running around. I don't have to think about all your people. Yeah, I think I'll be sitting somewhere just like enjoying family time. Because money makes us get up in the morning, go to work, come home, and just do it over and over again.
okay? Well, I love cooking, so I think I'll do like doing cooking shows with people, just showcasing households with their recipes. I know there's no money to make there. That's why I would go there because I know I'm going to enjoy learning different recipes, but I won't get paid. But that's okay. It'll make up the time. I'm telling you. All right. Community news. This is interesting because, as you all know, the first was HIV/AIDS Day, International Day. So we have Miss Winnie Musonda, who is from Winnie Musonda Hope Foundation. She's having a red carpet gala in New York. Um, like we've said in the past shows, if you cannot make it, there is nothing wrong with you donating towards the ticket that you won't be attending. This money goes a long way. Miss Williams on the foundation has done a lot for young people that are going to school, that and in college actually they've benefited from Williams on the foundation fundraising galas that she's done in the past. Winnie, this is what, the sixth?
This is the sixth, yes.
Yeah. So you can imagine for 6 years she's been catering to these vulnerable children that parents died of HIV/AIDS. And Winnie is going to tell us a little bit about that so we can know. And maybe we should share the link to where people can donate as she speaks. We need to take it off.
Yeah, I'm taking it off. I'm waiting for my co-host Malita Bewe should be joining us soon. But the gala is going to be happening on the 9th of December. That's
Mhm.
next week. And the reason of us doing the fundraising, we pay for tuition, school fees, school supplies as the year begins. And we have taken so many kids to like four to college last year because we started doing college, and then we have other kids who going to school, so we do school supplies, uniform, and all that stuff. So just it's just not the gala to just come and have fun and jump up and down. It's for that reason. And then these kids, HIV/AIDS is not a sentence. These you still have life, they still tomorrow. So if we give them the purpose of having a normalcy and just be like one of us and take them to school, I think it just gives us the peace and the love that whatever you have you can share. So please, if you're not able to come, you can still make a donation. And we have all that information: Women's on Foundation, Zelle, we have Cash App B110290. That's Cash App. And then we have number you can call for all the information that you need.
Okay, that's good. It's funny because last week we were talking about this same thing. And you guys, this is how serious Williams on the Foundation wants to do this gala. Guess what? There's a payment plan to go to the gala. There's a payment plan because we want to make sure everybody has a piece of this because there's no excuse. No, I can't pay the whole 145. It's okay. Pay in bits. This week, $10, next week, $50 until you finish. It's very important for us to support such a cause because this is our country, and most of these like associations, organizations like Winnie, they look up to us big time. Next, Noah, you have to come to this. You really
Yeah,
have to attend this. We're having,
yeah. See, I'm working around my schedule, trying to see how we can make it happen. Because I know HIV and AIDS is something that we should all support. Because we know someone, or we are that someone. We have been impacted by this disease, and it's something that all those who are doing great works like Winnie should be supported. So I encourage the listeners around. You could be outside the USA. I'm sure arrangements can be made for you. So it's a great opportunity to be part and parcel of this great project that is being put up. So I encourage people to jump on, and I'm working around my schedule because I have a conflict on that day, but I'm trying to see what can be done.
all right, thank you. Even just the thought about it counts. It really counts. The next very big event that we're going to have, you guys, we've been working so hard. This is our third year doing the Insaka talk show. For those that don't know us, we are four of us. There's Priska van der Vestas Chilwa, there's Nelly Bartholomew, there's Winnie Musonda, and there's me. We're all from different states, and we started this show so that we can all learn together and grow and educate each other, enlighten, empower, just powerful things that have happened on this platform over the 3 years. So it's time for us to let our hair down, enjoy this very beautiful gala that we are about to have next year. It's called the Gold Carpet Gala. We're calling it Gold Carpet Gala because we're just very golden, as you know. So we are going to give a date as we go because we are still looking for a very good venue that's convenient for everybody that's going to attend. Okay.
Oh, Sorry, I think I muted myself.
I was like, what is
Because I was talking. I was like,
anyway, this past Saturday, we our co-host, Miss Priska van der Vestes Chilwa, had a beautiful birthday. These are shout outs from all the people that support us, fans, friends, and family. Birthdays never end. The whole December, she's still going to celebrate her birthday. When you get time, please write something beautiful on the on our page and wish her a happy birthday, even if it's not the actual day. Um, yeah, happy birthday, my love.
birthday, Priska.
Yeah, you know what? We have a very touching, trending topic, and a very enlightening one. So I'm gonna start with the enlightened one, the M Nation. We know, M Nation. We love you. Um, if you don't know now. We love you. We heard little birds saying that you have a nice bill. I mean, look at him, Tay Green. Let us know, Miss Musa, Miss Mutale Mwanza, if this is what we think it is. We want to know so we can congratulate you and celebrate with you. But we're just going to leave it here until you tell us if it's true. We don't want to be part of the rumors.
I think I'm happy for her. I'm happy
Yeah,
for her. She seems to be happy. If it's a rumor, not rumor. Hmm.
they look good together, though.
They
They
do.
look good together. Yeah, if it is an item, yeah, it's a beautiful couple. They're a beautiful couple. So we'll hear from her. I'm sure we will hear somebody from M Nations should tell
M
us what.
Nations will let us know. Will let us know.
Exactly. Well, before we go to the next oh yeah, we're ready for that. Um this
Rosie
is
Binani.
yes, this is really sad because I watched this video like so many times, and it made me really cry. It made me cry. So Rosie is a young lady who was a nanny in some Arab nation. I don't want to mention the actual countries because I don't know if there's any discreet there, but she she was a nanny for a family, and I think she took care of four little kids. If I'm not mistaken, they were like 7 years going now, and she had to go back home to her country, and they escorted her to the airport, and the kids could not stop
Mm.
crying and grabbing her and wanted hugs and didn't want to let her go. This is to say that there are good people that have a good heart, not because they are paid for a job. This is to say that she's probably naturally a very good human being that comes from a very good, you know, um, humble home that taught her how to love with no color discretion. So she did display that, and that's the reason why the kids were crying for her, and they wanted her. They didn't even want the parents. As sad as it looked, they didn't want the parents. If I were the parents, I wouldn't even put that video out there. I
No,
wouldn't.
I know. I think it's just love. I think that's just. I think I didn't see the video, but I heard of the video. I think it's love, and you don't have to be a parent to love children or to just express love. So that's what
Yeah,
I saw that.
but I'm just saying, as a mother, I would feel so bad that my own child would choose another human being and say, "This is Mama." I think if you follow their TikToks, there are some that the children are calling Rosie Mom. Yes, that's how bad it is.
I need to go watch them.
You need to watch it. I watched so many times. I was like so mad. And I'm like, you know what? I don't know what was going on here, but I just looked at the first video. I'm like, it is what it is.
It is what it is.
Yeah. So, other than that, where's our co-host Noah?
I think you'll be right back. I think we're gonna go on a commercial break, and then we'll be right back.
Okay.
My whole life, my father told me stories about moving to the United States. He would tell me that his brother, my Uncle George, was already living here and let my father stay with him for a while. Through my Uncle George, my father was introduced to our cultural organization here in America, who helped him make connections, apply for college, find his first job, and adjust to life in a completely different culture than he was used to. The Cultural Association helped him get started on his new life. My Uncle George would bring my father with him to the annual Summer Cultural Groups Festival, and later, he would bring me. It was incredible to see so many people of all ages laughing and celebrating with food and song and dance. It brought back the best feelings of home and gave my father the opportunity to pass his culture, language, and values on to me. My father and Uncle George were very close, so when George died last year, my father wanted to honor his wishes to be buried with a traditional ceremony back at his birthplace. My father told me that because Uncle George had cultural group life insurance, he was able to afford to bring George home and have the traditional burial George wanted. Though my father had been able to honor my Uncle George's wishes, it got me thinking about my own family. One day, I'd have to make the same arrangements for my own parents, and my wife's parents as well. Of course, we would want to bring them home and honor their wishes, but it would be a financial hardship for our family. There were a lot of things to think about, even though I really didn't want to think about them at all. When my father told me about cultural group life insurance, he told me it's intended to help families when they need it the most. It's not tied to an employer, so no matter where my career takes me, I'll always have coverage. The more people who participate and the younger they are, the more it helps keep the insurance premiums down for the entire association. Because my parents have cultural group term life insurance, there will be money available to help me provide the kind of service I want to give my parents. And by joining, I can put my mind at ease and continue to celebrate our traditions into the future. With cultural group life insurance, I can worry less and spend more of my time celebrating with the people who matter most to me.
Hello. Hello. Welcome to the Insaka Talk Show this afternoon. Hey, Miss Irene.
Hello. It's cold, Mandin. It's very, very cold. I
Monday.
was I had to say Mandini. I'm so sorry. It's
That's
very
fine.
good. I was trying to call somebody to bring me some coffee and they didn't hear me. I was like, man. Anyways, I'll tough it up. Noah, you're back.
Good to be back. Good to be back. I don't know. I'm having some challenges with the lighting, so I think we'll run with that. At least people can hear me.
That's
Yeah,
fine.
they can hear. We can still see you. It's just a little dark, but that's okay. We can actually deal with that. We Malita was supposed to come. I don't know what's going on, but we're just going
She's
to
there.
continue. Oh, she's
So
there?
she's there. So now we're gonna introduce Malitam Bewe, and she's coming in. She's from Williamson of Foundation, so she's gonna be joining us.
Oh,
Hey,
there
girl.
you are, Malita.
Hi.
Hey.
Hi, how are you?
Good. How are you?
Good. Happy
Beautiful
holidays.
ladies and gentlemen. Happy holidays to you too.
Thank you. Thank you so much for coming to the show. And I know you guys are very excited about the Williamson Foundation Gala, and you want to talk to us about it. So it's your show. Go ahead.
Yes, we're very excited about it.
Yeah.
So this is our sixth annual gala
Yes.
that we're having. We usually have it in Jersey, but last year and this year we're having it in New York at Terrace on the Park. It's a beautiful venue, and we're really excited about it. And the whole purpose of the gala, I know Winnie mentioned a little bit about it. We are actually fundraising for a youth community center. So for those people that don't know, we actually have about 100 kids that are part of WM Hope Foundation. And they're basically our ambassadors. Like, you guys see Winnie and you see me, like, hosting all these events, but our kids are really the true ambassadors that are out there in the field. They go to different schools to educate their peers about HIV and AIDS prevention, and if you have it, like, it's not the end of the world. They basically have a community that they have created that helps to they support each other, and they meet like what monthly, Winnie's. they
Yeah.
they have monthly meetings, and they just, we want to have an actual space for them to be able to meet,
Yeah.
where they can play sports, they can study, they'll have computers. So just having an all-inclusive center. And we have been fundraising for that, starting from last year. Like, we have land that we've been able to purchase so far, but that is only phase one. We still have a long way to go. So that is basically the main purpose of the gala. We're looking to continue fundraising for the community center.
Okay, that's very good. I'm glad that you guys, um, on the 6th year anniversary of Williams on the Foundation, you're able to talk about things that are huge, like we bought a piece of land, and explain to the people what you're going to do with the land so more donations can come in. Because a lot of people give into a charity that's actually operating on the core of their objectives. If you say this is what we intend to do, and they actually see you doing those things, over the years, over time, they tend to give more because they see that you are grounded, you know what you're doing, and you actually keep your word.
That is true.
Congratulations on that. Yeah.
Thank
Thank
you.
you.
Um, yeah, and we have told a lot of people that if you're not able to come, you can donate. You don't have to donate the whole $145 ticket, whatever you can afford to donate, because we don't
Yes.
want people to feel like subjected to like, yeah, I don't have 145, I'll give next year. No, you can give anything.
Yes.
If
And
you
then
can,
to tap on what you're just saying, Irene, you can give anything like a land. The land we have phase, like Malita says, we have phase one. We're gonna need cement. We're gonna need blocks. So if you say, I don't have this amount of money, but I can buy 10 blocks, I can help you
Yeah.
yeah,
buy two cements.
yeah,
Like, guys, it's gonna take a village in order for us to be successful and have a community center for the kids. Because
Exactly.
over here in the US, we have like a boys and girls club. We don't have that back home. So we just don't want
yeah,
them to be idle. If they have somewhere where they can meet every day and have
yeah.
food. So that thing is include food banking for the
Okay,
kids.
that's good.
Because
That's
you
good.
can't be just taking medication without eating.
Yeah. And I think earlier you mentioned something like you've empowered 4 students who are now in college or something like that.
Yes, yes. I think we have a couple of maybe like two photos I put there. One is in grade 12, he just went and write his exam. But I think we have Judy and other kids in college, yes. And we hope to take more kids to college because all these kids they are now going to college. We met them when they were, that's Judy. She's at Levi Monasa University. Yeah.
That's very nice.
I know. And
That's
that's
very
Mike
nice.
Zulu. We met him like 4 years ago. Now he just finished grade 12.
Yeah, this one just makes me cry every time because I saw the pictures that you shared when he was little, when you just picked him up,
Yes,
and how
Yes.
he has blossomed into this very
yes,
confident young man who knows what he's doing, and he appreciates Winnie Musonda Foundation. Every time he's on camera, he says that, that's the reason why you guys should give towards Winnie Musonda Foundation. It's not a joke. These guys are young, as you can see. Malita and Winnie are young people, but they have a mind of growing the country into a very solid and healthy country by empowering these young people who look up to them. So donate in numbers, please.
yes. And that photo right there is when they had this year. We were not able to go to Zambia, but the team on the ground there, they did an amazing job, including the youth. So that was part of the AIDS Walk Zambia,
Okay,
where we walk
that's
in the street, give out the condoms, and it's just amazing. And then they do testings at the event. It's just not the event where you come and eat. No, we actually do the work because it's HIV awareness. We cannot stop
that's
talking about it. And that's our
Yes.
that's
brand
good.
ambassador. That's Tilo is our brand ambassador.
Oh, that's very nice. That's Tilo. Oh
Yes.
yeah, it is. You would know him from his hair.
Tall.
He's very, yeah, tall, and he's very adventurous with his colors in his hair.
The green
Yeah,
Uh,
beard.
AIDS Zambia is our biggest outreach at the
Yeah.
moment. We started it, when was that? 20,
2015.
yeah, 2015. And we've had like over 500 people partake in the walk. And like Winnie mentioned, at the end of the walk, like we have everybody meets at the community center. They have food, they have drinks, they have drama. Like it's so much fun. And, also have testing and counseling. So we're very proud of that initiative. And yeah, like when you mentioned, like me and her were not able to go, but the team, the kids back home were able to take the initiative and still have it this year without us being there. So we're very proud.
that's very nice. I'm so. Oh, okay. You know what? That's another thing. Let's read some comments, so that people know that we are actually watching. That's Mo. Um, Whoopi Mwape said, "Affected and infected, we are one." You're right about that, Whoopi.
I will
Um,
pay. That's our
Hey.
Bupe. See, that's
and
on our
that's
that's our accountant. She's telling you, please.
yeah.
They're
Yeah, Whoopi was
playing.
supposed to be joining us,
And
but
you see, she's like,
unfortunately,
"Please donate,
please
please."
donate. She's having
You
some
you
technical issues, so she's not able to join us today.
Okay,
But
no,
we
that's
miss you,
okay.
V.
So, since this show is packed with different segments, we have some other people that are coming to talk about the actual HIV/AIDS epidemic. We need to make sure that people know about it and they know where it, like the do's and don'ts, and how far we've gone with this thing and the advancement that's there. A lot of people don't know. They still think, they still have stigma, thinking that, if you share a cup you can get it. if you
Mm-hmm.
if you kiss somebody you can get it. All those things are just stigmas. So we need to learn a little bit more about it. So we have professionals on the show that will ask them questions, and they can enlighten us on some things that are confusing, even to us who know the HIV AIDS pandemic ourselves. So we have Noah Ndhlovu. He's a public health um, analyst, right?
Yes.
Yes, he was with the state of Indiana, working under, I think, the health department. When I met him, I was also under that a similar program with the state of Illinois. So we kind of had similar conversations in terms of HIV. He was in the testing. I was actually in management. So mostly management and counseling. So I'd place people into medication and all that stuff. So without any further ado, let's dive into the questions so people can learn a little bit about the show itself. Um, so, you know, um, I wanted you to explain a little bit, like just to enlighten people, what is. I think we have acronym for HIV and AIDS. Some people don't even know what it means. So, can you just tell us what HIV stands for and what AIDS stands for, just to start the show?
Yeah, thank you, thank you. That's a beautiful question. So mostly people tend to confuse these two. I've actually seen this. So I'm just especially happy to be part of this show to share some
Mhm.
thoughts on HIV and AIDS. This is a disease that is so familiar to most of us, especially on the African continent. HIV stands for human immunovirus. It's the virus that causes the disease AIDS. So AIDS is the end result of HIV, and HIV has been around since the early 80s. It started out actually here in the United States in California and New York. At the time, it was referred to as GRID, or gay-related disease, because it was predominantly found in men who have sex with men. So the acronym in the United States is called MSM. So that's where, according to research, how HIV was studied out. So that's a little bit about the what HIV stands for and what it is. So the difference between HIV is that it is the carrier or the vehicle through which a person, if untreated, they'll end up having full, like most people would use the term full blown. But some of us who are working in the public in this space, there there are certain acceptable words or acronym that you can use. You cannot use full blown because most people
Yeah.
feel like no, that is stigmatizing.
Hmm.
So yeah, so there are words that we'll talk a little bit more as the show progresses, but I just wanted to make mention that HIV and AIDS, though it's very much prominent, especially in the developing world, but it started out here in the United States. Thank you.
All right. Thank you so much for that. Ladies, do you want to ask any questions, or we can go to the next one so that we have very good questions, and I think it's very important for us to know all of them for our own knowledge as well.
I could comment on that.
Hmm.
Winnie, you're on mute if you were trying to say something. Um, it's interesting that you say that it actually started here in the United States. And just in doing research, like in New York City, actually has one of the highest HIV rates
Rates.
in the
Yeah.
world.
Yeah.
But it's so funny how here in the United States, people would rather say that they have cancer
Yep.
than
Hmm.
to admit that they have HIV. And it's like, it's here, but it's like nobody talks about
Silent.
it. You know, like in Africa, like everybody talks about HIV and AIDS, but here it's they actually have a really high rate of HIV infections,
Yeah.
but they don't talk about it.
Yeah,
Yeah.
yeah. Especially also in the South, if I can just jump in there. So places, for instance, when you look at the Florida. Oh, by the way, before I progress, I realized that I think the only reason why I have my lighting is not good because I think I'm the only one who doesn't have hair, so I think there's a correlation there.
And you're
That
also
is
not
funny.
wearing red.
I think I
Oh,
was about to say no. It's the red that you're not wearing.
I like that.
I think it's the rage and the hair. So
And then
yeah,
you just have no light.
We'll give it to you. Don't worry.
yeah. So Florida, the state of Florida, and Georgia, at times there was a time when the prevalence was very high. It
Hi.
was
Yeah.
actually higher than in the developing world. So one of the things that I think we as African people have to be very careful because when we look at the origin of AIDS, there is the acceptable origin of AIDS, which is put out there,
Hmm.
but there's also some research which I've worked on for quite some time. There's a gentleman who was called Hilary Kaprowski. This is back in the 1950s. So there was a competition between who was going to be the most prominent virologist because in academia, there is usually this competition of who is going to get this grant, who is going to do what, and things like that. So there's always a competition who is going to be the first to discover or to come up with something. So according to the research, there is a place in Congo DR. Back then, when I was growing up, it used to be called Zaire.
Yeah.
But there's a place called Lexington. So in Lexington, back then, right now, this time they use the word Kisangani. So if you go to Kisangani, there's a place where they were carrying out experimentation using chimpanzees. So this is
Mm.
back in the 50s, but that
Mm.
research was in line with the finding out smallpox and things like that. But there is research which seem to pinpoint that according to the people who were back then in the Kisangani, because when you take the HIV virus into a chimpanzee, the chimpanzee is able to digest, and that the chimpanzee is not really affected with the virus, but it only affects humans. So I just wanted to make mention that though we say HIV started out in the 80s in the gay community, which was called gay-related disease, and later called HIV. And but there are two schools of thought in terms of its origin. Back in the 50s, the research carried out by Harry Kaprowski and his team, and recently in the 80s. So the acceptable school of thought is that HIV started out in the 80s. So I just wanted to make that clarification since we're trying to educate our people, so at least
Yeah,
you have both sides of the story.
absolutely. I'm glad that you re-emphasized on that one. Um, so we'll go to our next question.
Irene,
Um,
before we go to
yes.
our next question, I think we have Dr. Grace joining us.
Oh, I didn't see she joined. That's why I put the question there. Oh yeah, I see that. Sorry. Remember, I had mentioned that this show is packed with a lot of information that we need to feed our followers, our fans, our viewers, our family, and friends. And we have two experts on the show, Mr. Noah Ndhlovu, who's just finished talking. And now we're going to introduce Dr. Grace to come to the show and join us. Hello, Dr. Grace Mukupa. Hello, how are you?
I'm good. Am I muted? I'm good. How are you, ladies? I got
I'm
the memo, so I know I got to
Oh, I've seen that. It's red
so
and here.
know, right?
So thank you, ladies.
No, you're welcome. You missed a lot, but you didn't miss a lot
Oh no,
because
I
you
was
already
listening. I was listening in.
okay, that's good. I was gonna say you missed a lot, but you didn't miss a lot because you already know this topic with your eyes closed.
Yes, yes. Thank you for having me on the show and with a great friend of mine, Dr. Noah.
Yes, I know. But thank you so much for coming. And then you're just going to dive in as we continue on the questions, so that you know where we are. We're just kind of like talking about the difference between HIV and AIDS so people can know the difference and its inception. There's a lot of questions about it. So let's dive in into the next question. So who is at risk? I'll ask Dr. Grace to answer that one since you're the newcomer here.
I mean, like who's at risk? I think everybody is at risk if you're sexually active because that's how it's transmitted, right? The other part is we have to look back in the beginning. I think Dr. Ndhlovu did mention that he covered the context of HIV/AIDS. But
Mhm.
for me, I want to look at the young girls, right? They're at risk. And I just interviewed, when you invited me to the show, I interviewed young girls in Zambia. One of the ladies shared with me that she was pregnant and she was forced to test when she got to the hospital and she tested positive. She came home and told her boyfriend, and that boyfriend left her on the street. So we have gender-based violence. We got to look at the context of our society, in our culture in Zambia also. The woman is left alone, and
Yeah.
sometimes boarding schools. I interviewed different NGOs. They said, oh, you know what, the parenting is missing when someone goes to a school for boarding school. Then they want to
Yes.
look at a higher being, someone, because they want to wear good things and do things to be
Yes.
part of the mainstream. They want to reach out to an older person to date. So that, in other words, it's prostitution, but we don't want to call it, right? But it is what it is. Prostitution,
Exactly.
but you want to fit in society, but the parenting is missing. This is girls and boys, parenting is missing. And we also see that the culture changes when you leave the household, and also you want to meet, you want to be like your friends. So at risk, I'll say everybody is, but we got to look at the women who are on the streets, especially those waiting for my exams, grade 12. They have nothing to do. What can you do now? Right. So what we need to do in a government, to look at the bigger picture and work with different ecosystems to understand that this disease is still there. By the way, Zambia is 10% of the population.
Yeah.
It's still a high
Yeah.
number. We need to reduce it, especially in 2023. So let's educate our people. Everyone is at risk. Just to answer your question, as long as you are sexually active, you are at risk. Newborn kids, even if you're not at risk. So thank you for that question.
No, that's
Thank
okay.
thank you, Dr. Grace, for saying that. And as Williamson Foundation, like Maita was explaining, that's why we are trying to build a community center for the kids, because we can't just leave them idle doing nothing, because out there it is
Yeah.
no good. But if they engage themselves into something, that's why we are not specialists as you, but we are on our foundation. We're trying to solve a problem, because if we're not doing something about it, we can't wait for the government. So us as the community, we come together, we do something, we can make it happen. We can only contribute to the government.
Mm-hmm.
Yeah.
And there's I think a TikToker who was saying something like the new kids in town now, when they go to college, university, they're coming back with education and HIV.
HIV/AIDS. Yeah.
Yeah, so they have two certificate, one a school certificate and the other one is HIV certificate. As bad as it sounds, there's a lot of truth to it because I know some kids back home when you ask them they're HIV positive and they say I'm taking medication and I'm okay. And I'm looking, I'm like, why are you not freaking out? I'm freaking out just hearing that you're HIV positive, and she's making it sound like it's nothing, you know? So
It's
I think
good.
education is good.
I think it's
Mhm.
good to normalize it, but it's like how they don't care about it.
Yeah.
The whole point here is to normalize it, so we take off the stigma, so everybody, we are all the same. But just take care of yourself if you can, because there are those people who are, it's not their fault, they found themselves being HIV positive.
Mm-hmm.
So, okay, now, so how often should one get tested? Like Dr. Grace was saying, who is at risk? Is the people that are sexually active, especially if you're not using protection. So, how often should one get tested if you are active, sexually active? How often should you get tested? Every 3 months, every 6 months, once a year? What is the appropriate time frame? I'll ask Noah
No what?
that question.
Right. Yeah, I
Yeah,
think.
because you're in the testing field.
Yeah, yeah. So thank you for that question. Yeah. So as long as you're sexually active, you want to make sure that at least you are getting yourself checked. So according to the Centers for Disease Control, which is mostly here in the United States, they put out recommendation that each person when above 13-year old, because I know we may want to think that nothing is happening during that age group, 13,
Hmm.
14, because these kids nowadays are very advanced. It's not like the time that some of us were growing up. But according to recommendation by most of the health organizations, CDC, World Health Organizations, and others, they recommend that at least once, if you are not very active, but you want to make sure that at least you get yourself tested of depending on if, for instance, they are what we call transactional sex workers. Those, it's routine. Transactional sex workers is just a fancy name for saying sex workers, but again, they are certain acceptable terminology or words which are not stigmatizing, because when you say somebody is a sex worker, most people feel that's not the right word because it makes people feel, because we live in an age where feelings are more, you have to watch what you say. So
Yeah.
you cannot, for instance, say somebody is infected with HIV. You have to say somebody is living with HIV. So a transactional person who has the word transaction simply means you are using word sex as a means to survive. So mostly those people who are uh, uh, they are in that line of space, the recommendation is you want to get tested as often as possible. So what does often as possible means? Before you have sex with anyone, you want to make sure that you know their status, because you have to look out for yourself. So the answer is, you if you're having sex with somebody whose status you do not know, you want to make sure that at least you do your due diligence to check, to ensure that you are protecting yourself and the other person is protecting. themselves. So that's my response to that one.
Okay, we're going to go back to the stigma. The stigma is very important, especially for us of African origin, because I think that's hurting our communities a lot. So, can we talk about the stigma, Miss Winnie? I would want you to take this one because you are running a foundation that has a lot of young people. What have you seen so far since you have a group of children that are HIV positive in terms of stigma?
I'll just talk about it a little bit and I'll leave it on to Dr. Grace.
Mhm.
Um, it's very, very hard that when you look at people and then you call them by, oh, even che. Even over here we do it. If I have a friend, we are fighting, I'm gonna call on you because you're
Yeah,
HIV, we're living with HIV AIDS, like Noah says. Not like
yeah,
you have HIV AIDS. It's very sad, and I have seen it on my end where kids could not take medication and when they die. So I don't want to go push too much further. I'll leave it to Dr. Grace to say that more into stigma because I know how it affects people. Because even me, my brother died because of stigma. So I want to hear from Dr. Grace.
Thank you, Winnie. So I want to thank your organization. They're one of those organizations that are changing the lives of
mm,
people. So we know that people living with HIV/AIDS every day,
Yeah.
they face discrimination, isolation, rejection, mainly from their families and communities. And these are people that's supposed to love them. And social stigma is literally fueled by misconception about HIV/AIDS and transmission. And sometimes it's deep rooted in our culture, about the disease. And the myth about HIV/AIDS, we the myth exists, but we have to love our people. And I can give you an example. I was interviewing someone from Mumbwa. Sometimes they said, "Oh, banamuloza."
oh yeah,
HIV/AIDS. So
yes,
misunderstandings such as the belief for HIV/AIDS, how it's transmitted through utensils. Sometimes they said mosquito. I know you guys have heard that.
yeah,
Mosquito bites, right? It leads to discrimination against individuals. And I also, I was in Zambia this summer. I met with a couple. The woman had no idea the man was infected. The man didn't want to tell the woman because he loved her so much, because he thought she would not marry the person. And some of these kids have some of the couples have kids, and kids didn't have HIV/AIDS. So the fear of disclosure is another significant
yes,
aspect. HIV stigma. Many individuals living with HIV/AIDS are hesitant to disclose. Another person I interviewed said she didn't go to church. She stopped until the pastor came to her house and said, "You know what? You need to go back to your job." Right? You need to go back to your job. It's a fear, not just of the results. I think people need to realize when you are diagnosed by HIV/AIDS, if you didn't know, it brings a fear. It's a mental health. Those
yeah,
people need to be loved by
yes,
by their own communities, but this community is literally discriminating them. And
absolutely,
this brings vulnerability of the population, right? HIV status should be shared. This is 2023. Zambia is one of the countries that have centralized the medicine. I don't know if you guys, I stayed at the lodge. They had condoms at the lodge in
yeah,
1980s, 1990s. You guys, when we were
yeah,
younger, when you say
it-
HIV/AIDS, it was a death sentence.
Yep.
yes,
So the stigma still exists. How can we get rid of our stigma? It means getting rid of our culture, and we love our culture. So what we need to do, as Dr. Noah was saying, is to educate our communities about the facts, not the mystery, not the myth of HIV/AIDS. So stigma will always be there. People
yeah,
talk to you behind your back about you behind
Yes.
yeah,
your back, but what is important is your health, for you, for your community, and for your family.
Okay,
I
family.
can go on. Y'all know me, so.
no, that's okay. I mean, it's a passion that you have in this
Mhm.
on this topic. That's why we want to hear. We have a lot of people that have clouds in their head because they don't know, even just as simple as what is AIDS, what is HIV. They didn't know. So I'm glad that we tabled that, and we need to dive into another question, which is what are the common symptoms? Because I think there's a lot of misunderstanding on this one. People think if you are skinny and you have pink lips and your hair is falling, whatever description they have in their head, then you're HIV positive, which is not true. Somebody can have a liver problem, why they're thinning. That's the reason why their skin is a certain way. It could be any other disease. We should stop being doctors. We're not doctors. You have to go to school and study for 7 years plus in order for you to tell somebody what they have. Do not start telling people, oh, oh sorry, I'm not supposed to.
I wanted you to go in Nyanja or Bemba.
No,
That's the
I
one I
can't
was
do
looking.
that. No, I don't want to do that because we have some people that say they don't understand Bemba. But
Yes.
in a nutshell, what I'm saying is we should stop doing these things because, like Dr. Grace said, they need our love, they need our support because some people get this disease without even knowing. They didn't know that they got it, either through their partner or however they got it. So who are we to go and judge them about something that already is torturing them internally? I think it's just love. So, what are the symptoms, common symptoms that we can see? I just had to go somewhere else because I'm also passionate about this. What are the common symptoms that we see? Other than I think, if I remember in my schooling, it's you get tired a lot, you know, loss of appetite sometimes. Um, you can add in you guys if you can. Doctor,
What are the symptoms of
symptoms of
HIV/AIDS? I
the
think Dr.
common
Noah can tell us more. No, Noah can let us know about the symptoms.
Yeah, so thank you for that question. Yeah, so HIV is one of those diseases which is very hard to pinpoint because you can never tell. It's not like somebody has, it's gonna look a certain way. So this is why it's very hard to contain. But the common symptoms, I think I will defer a little bit also to Dr. Grace to chime in. But the common ones is obviously somebody is acting out of the normal range and fever and having uh, common symptoms which are attributed to other diseases. So this is why narrowing down just like the exact symptom that a person has because of HIV, in most cases, people don't even have any symptoms.
hmm
So this is why it's one of the most challenging. The best way to know is to get tested because the person will be looking healthy and strong because it takes some time for the virus to mature in the body. This is why for a person, for instance, may have sex today and may not notice anything because the acute window and it's the first few days to a week the virus in the body is at its height, but then
Yeah.
it gets to a chronic stage. So the common symptoms for HIV vary per person. I think I'll have Dr. Grace chime in.
Yeah, I would say that for the first few weeks and I would say 2 months, as soon as you contact the HIV/AIDS, I think it's more like flu symptoms, right? You're experiencing that. You because HIV/AIDS, it really attacks the cells, so you will feel tired, right? It replicates itself, and once it kills the T cells, you have more HIV/AIDS. And the T cells, I could describe them as when you call 911, you're being attacked. Those people pick up the phone and come to rescue you. Those are the T cells. They rescue from any diseases and anything. But it attacks the T cells, so you will feel fatigue. I think if you have a little soul, it will persist. Maybe instead of healing in the next 1 hour, or maybe 2 days, it will take longer than that. You will experience, of course, weight loss, fatigue, and other infections will come in and going. I've seen people that I've interviewed have diarrhea, some, swollen lips and skin rash. But that's not HIV/AIDS. It's when it gets to AIDS, right? When you're really suffering because your oral problems. Sometimes people don't talk. So those are just some of the symptoms, and not all. And we might leave some behind. And as the research is ongoing because we don't have the cure. So as time goes by, I think those symptoms that Dr. Noah said and what I'm saying will increase as time goes by or reduce. Who knows, right?
Okay, that's good. This is very interesting. So now this U equals U. I think I'll chime in with this question with Noah on U equals U. Do we know when it started, and can you elaborate a little bit how they came up with U equals U?
Yeah, I can think about that question. So U equals U is one of the strategies for ending HIV, because the World Health Organization, along with the Centers for Disease, they are working on a plan called EHE, ending the HIV epidemic. So
Hmm.
to reach the zero infection, for instance, the United States has a 5-year plan that they aim to reduce HIV cases in the next 5 years by at least 75%. But in the next 10 years, they're looking at 90% reduction of HIV cases. How is that going to be achieved? So that is achieved, for instance, by concepts like U equals U, because when a person is adherent to medication, when you take your medication every time, you reduce the viral load in your body. So when you reduce the load in your body, it means you get to a point where the HIV is undetected. So when it's undetected, which means it cannot be transmitted. So U equals U simply means undetected equals untransmitted. So that, in simple terms, is people are able to have sex without the use of a condom, and a person cannot transmit from a person who is living with HIV to the person who has not HIV. So that is simply what U equals U. It is why most people will see somebody has HIV, but their partner does not have HIV. That is simply because they're taking the medication, the virus load in the body is reduced to a level where they are able to interact, relate with their partner without the use of any protection means. But that doesn't mean that protection becomes, the use of condom is no longer needed. It just means that the viral content in the body has been contained so much that it is now okay or safe for one to interact, because you cannot transmit. So this is, in simple terms, undetectable equals untransmitted. Thank you.
I
All
would
right.
say that follow up with you. Me and Malita, I think we can testify to that. We have our one of our son just had a wedding. They have a son, and the wife, she was not she's not HIV AIDS, but he was, and they have a daughter,
Have a
a
baby
son and a
together.
daughter now, and it's beautiful. So we have success stories because they're using PrEP, which is Dr. Grace will come through. But we've been having this where we have kids who are not HIV AIDS with these young kids who are born with HIV AIDS, and it's a beautiful story that when you stay in here, you prep yourself, you plus you, but doesn't mean that you should stop using protection. You can only use these tools when you're about to have a baby. I feel that's what it should be. Let's not misuse ourselves that, oh, I can't use condom anymore. Please stick on your condom when you're about to have a baby, and you know it's safe, then do that. Go on prep. So Dr. Grace.
You wanted me to talk about PrEP?
Yeah, you
Prep,
can
yeah.
talk about prep.
Yeah, which is a pre-exposure prophylaxis. I can't. My accent will coming out, right? So it's actually a mechanism to stop the. I think we spoke earlier. The disease replicates itself.
Yeah.
It's a way to stop it from replicating itself, and it's recommended for people at risk, mainly through needles, obviously through sex. Um, and expose. I'll say this mechanism does inhibit replication of the virus, but also people are having sex. It's often, I think, Dr. Noah,
Mhm.
just correct me, by
Mhm.
90%, it reduces the risk of HIV/AIDS, according to data, by 90%. So I support it, right? It's also not just recommended for people high risk. Um, I think PrEP is very effective. It must be taken constantly, daily, just like any other HIV/AIDS medicine. We know at some point people get tired of taking the medicine, you got to take it daily. Adherence to
Yeah.
this medicine is very critical to maintain its positive effect in your body, because your body gets adjusted to it. It is important to note that PrEP reduces the risk of HIV/AIDS. It does not limit, it does not take it away completely. Those individuals who take, they have to continue other prevention methods such as condoms, right, reducing the risk of sexually transmitted disease within a community. I'm saying we have a lot of access to this. It depends on your country and region. I did mention Zambia. Zambia, even people in the villages have access to ARVs or any other medicine. Even you don't have to go to the same clinic. That's what people need to know.
Mhm.
I could be in Lusaka traveling, I could be Monze or Chipata. I can stop by nearby clinic where people don't know me, right? Where the stigma
Yes.
is not there, and
Hmm.
get the help that we need. So exposure is real, but I do think PrEP is another method to help our society move forward, so our loved ones can live longer and love their families.
Yeah, yeah, yeah.
Let's say,
Just to, oh, sorry, if I can just chime in a little bit.
Yeah, I was gonna say, Dr. Noah, within 72 hours, it has to be initiated within the 72 hours of the exposure to HIV/AIDS. So I'll pass the mic.
Yeah, yeah. Thank you, Dr. Grace. So, when it comes to sex, from our African perspective, sex is looked on differently. So I'll break it down a little bit. So sex is divided into two. There's what is called incentive sex. That is, for educational purposes, excuse my Africanness a little bit. I'm going to sort of wear my academic hat now. Yeah. So when it comes to sex, there are two perspectives. There is the incentive aspect where you insert something. And then there's also what is called receptive sex, where you receive on the other end. So mostly in the MSM community, men who have sex with men. So when you are being prescribed PrEP, which is just a fancy name for pre-exposure, before you get exposure, prophylaxis, it simply means prevention. So before you get exposed, if you are, this is mostly for people at the higher risk. So injection drug use, this is not very common, especially I think I'm hearing it's getting big in Zambia and African, but injection drug use, it's something which is big. For instance, the state of Indiana. Indiana is known for two things. For those who are in the public health, I think Dr. Grace would know this. Indiana is known for two things. There's what is called the Ryan White Act and Scott County. So those are two things when it comes to the HIV. But PrEP, you want to make sure that if you are in the male versus male sex, that is sex using the behind. In this case, if you are taking PrEP, you you cannot transmit or you cannot contain acquire HIV because after 7 days of using PrEP, your body has got enough PrEP in your system that within 7 days you're okay. So that is the type of incentive sex. And now the receptive sex, which is mostly in the heterosexual male and female. So you have to take PrEP for a minimum of 21 days. So it's 21 days. That's when the body has got enough immunity in itself so that at least you are able to have sex without a condom. So without acquiring the disease. So in other words, if a person is on ART and they have sex with somebody who is not HIV, who doesn't have HIV, look at PrEP more like family planning. You take your family planning medication so that you do not get pregnant. So it's the same thing. When you take PrEP, you can go ahead and have sex, but you are preventing yourself. You, the person who is not living with HIV, you are the one who takes PrEP. And the person who has HIV, they take their ART. So when they are taking the ART and you are taking your PrEP to prevent yourself from acquiring, so the thing, the word is from acquiring HIV. So that is how the World Health Organization and these other organizations envision ending HIV, because you can now prevent people who are at a higher risk from having HIV. They take PrEP, and the people who are living with HIV, they take ART. So you have ART plus PrEP, then it results in U equals U slash EHE, which means ending the HIV epidemic. So this is why people may ask, how can they end HIV? It's because you have those two parties are taking medication. In the end, you have zero incidence of HIV. I just wanted to throw in my 2 cents on that one. Thank you.
Thank you. So at least we have a future of free HIV/AIDS. Because our children, they won't have HIV/AIDS if we are doing that. If you are sick and you are able, you should go there and look into this. It's very important. We might laugh, we might smile, but guys, we can change the world. We can change the future by having education and listening and learning and learning. Thank you, Noah.
And just to add up on what you're saying, here in Illinois we have the needle exchange program. I don't know if you guys have it in your state. Do you have it in your states, Noah?
Yeah, so the needle exchange, it's something that, especially Indiana being a Republican red
Mm,
state with Mike Pence, because in 2015, when for those, in a nutshell, let me just summarize. In 2015, there was an HIV outbreak in the state of Indiana in a little town called
Fort
Austin.
Austin, yeah, I remember.
At that time, the governor for the state of Indiana was Mike Pence, the former VP under the Trump administration. I'm
Mm,
emphasizing that because Indiana is a red state.
mhm,
So passing the needle exchange, this is providing needles to those people who are, the acronym is IDU, injection drug use, people who
mhm,
share needles, they pass them around, and sometimes that is how, according to the data that we have, that the outbreak in 2015 was as a result of injection drug use. So to prevent people from sharing needles, they uh, employed what has been mentioned here called needle exchange. They give you needles so that at least as you are carrying out your practice, you are using clean needles. So yes, the answer is it was very tricky to pass that in a red state. I know Illinois and other New York, California, these other states, they're a little bit on the liberal front, but it was such a big deal to pass that in the state of Indiana. And I'm very happy that I was actually, when I was overseeing the project for the state of Indiana, Austin County was one of my counties that I was overseeing. So I was happy at least to do that. Thank you.
okay. Thank you so much. Dr. Chris, do you want to piggyback right on anything before we jump on the
Oh
winning
yeah,
song?
just
Yes.
thank you, darling. Just one last comment is that we have to know that through this fight we're fighting, United
Mhm,
States has HIV/AIDS in other places. However, we want to know that the UN has what they call 90-90-90, and our goal is to have 90% of the people living with HIV/AIDS know their status, and out of those 90% that know their status, they need to know that they can, who are the status of antivirus. So we have to make sure that 90% receive the medicine. And finally, the 90% of people living with HIV/AIDS, they take antiviral is achieved. So it's a new, not stigma, it's a new call. The UN
Yeah,
call it,
ending the epidemic.
yeah.
yeah,
Yeah,
Just like
ending.
you equals you was a new thing.
there
Now
you
they're
go.
coming up with that. Okay, I see. So it's
Hmm.
one of those terminologies they're coming up with to end this surge that we've had in the world.
Right.
Okay, thank you so much for that. I didn't know about that. It's good that you said that. So we are behind time, but this is a loaded show. Like I said earlier, we're going to continue by asking Malita to tell us a little bit more about the gala, and I think you guys have some videos that you want to share so people can see what you guys have been doing. Malita, can you elaborate a little on that?
Sure. Thank you, Dr. Grace and Noah, for that informative session. I learned a lot just by listening to you guys. I think one of the things that um, I can just emphasize is that, for those that are infected or affected, is not to isolate yourself, but to have a sense of community, which is what our foundation really hopes to create for our kids that are part of the foundation. So, like I mentioned at the beginning, we do have the gala coming up next week, Saturday, December 9th. And we are fundraising to build a community center for the youth. And the whole goal of the community center is for us to be able to have like a food bank, be able to provide a space for them to interact, encourage, and support each other, have a library, just an all inclusive center for everybody. So if you're not able to attend, please, you can donate whatever you can. Any small amount helps and goes a long way. Everything that we're collecting will go towards building the center. And like I mentioned at the beginning, we already purchased the land. But if you're not able to donate any monetary amount, you can donate cement, you can donate blocks. Whatever you can do will go a long way. And I know Winnie has some videos that she just wanted to quickly share with everybody.
Yes, I think we have some videos that'll be coming through soon.
Hi, my name is Naomi Mwingajulukote from Zambia, openly living with HIV. So today I'm going to talk about U equals U. What is U equals U? U equals U means undetectable equals untransmissible. So basically U equals U works for people living with HIV on treatment. How do you achieve U equals U? You achieve U equals U by adhering to your treatment, eating healthy, managing your mental health and all stuff. And what are the benefits of U equals U? Benefits of U equals you live healthy. You manage your daily activities all the time. I mean, you'll be looking all gorgeous. You'll be going to work. You'll be managing your studies and stuff without having optimistic infections. And what are the benefits? Other benefits are you are preventing it from multiplying in your body, which is also preventing other parties from contracting it. Let's say, for instance, you have a partner, it prevents them from contracting it. So I would encourage people living with HIV to adhere to their treatment, to keep up with their appointments, and also to manage their mental health. Thank you.
I didn't have a hope to go back to school, but today I've received hope through you,
That's a
madam.
young.
I was out there vulnerable, helpless, but you have come through my way and picked me up. I say thank you.
That's one of Winnie Musonda's sons.
Yeah, no, thank you. It's because of the donation we go through, and because of you guys supporting us. It's not easy. We get stressed out behind the black doors. We call each other every minute, but God has been through good stuff. And we hope to see you this weekend. But Noah, if you're not able to come, those are the numbers. Dr. Grace already got us. Irene already got us. And the ladies and active my Insaka team, thank you so much for everything that you're doing, supporting us. It's everything that we ask for. So thank you so much.
Yeah, thank you guys for your support.
No problem. This was a very, very good show, and I'm hoping everybody that were listening in managed to learn one or two things, like we all learned one or two things. Um, if you have any questions, please send us a DM us and say we need this topic again. It doesn't have to be December, you guys. This is a disease that's been going on for years and years. We don't need to stop talking about it just because there's a gala and the first was HIV AIDS day. We can talk about it. Each one of us have either lost somebody from this or know somebody who's going through it right now. So we live with it every day. So before we go, I would love for Dr. Grace to say a few words, and then Noah say a few words, and then we can leave.
Thank you so much. I love those videos. I just want to echo to say that we have to be intentional in doing our work, and people who are sick or families, we have to work together. And I
Mhm.
also want to recognize the Zambia's commendable ability to accept and be willing, the government, the NGOs, just like yours, Winnie, and communities to work together. We have to commend the government's openness to other NGOs. By the way, United States is a top donor. Since 2004, they have donated 1.1, I can't even count, $135 million. So they have put so much money. So I just want to conclude that we have made a progress. We have to remember the progress that we've made, the lives that we have saved, the
Yeah.
resilience of the Zambian people. Zambia's journey towards HIV free country is an ongoing and a collective work of different, I'll say different ecosystem, different government organization. And I want to leave you out today to say that the disease is real. It is here. Let's embrace the medication or the medical expertise that are there. Let's try to eliminate untrue social stigmas, and let's empower economy to fight, to continue this fight. So I really want to thank you for bringing us to this table for us to include our voices. And I think Winnie, you're including the voices of those people who have HIV/AIDS. So let's continue working together to change Zambia
Yes.
for better Zambia-free HIV/AIDS. Thank
Thank
you.
you. Thank you so much, Dr. Grace. Noah?
Yeah, it's certainly a great pleasure to work with you, ladies. At least I make sure next time that I get the memo, so at least everything will line up.
And you
But
can wear a wig.
yeah, I've just placed an order for a week, so next time look out for the next time I'm on the show. Yeah, but in all seriousness, thank you, ladies. This is a very noble cause. Kudos to Winnie and Marita, what you're doing, and obviously Dr. Grace, as a health practitioner, you are in the forefront to so many conditions that you are faced with. So HIV has come a long way. It used to be a death sentence, but now there are all kinds of medical advancements that have been put out there. So we now have PrEP, which is a game changer because medication is readily available. There is much more that we need to do, especially as us, as our people. Obviously, we can look to the donors to provide the support, but it takes upon organizations like Winnie's organization and many others who are the boots on the ground doing everything possible to sensitize, to educate, to inform, and to teach our people. Because the only way we can be able to make a great difference is we work together as one to ensure that at least we are teaching, especially in the rural areas, to ensuring that at least the young girls who are vulnerable and many others that they are getting the much needed medication, much needed resources and education and just the support because HIV is also a mental condition. We have to do everything possible to fight the stigma because stigma is very, very real. So I'm just happy to have been part of this conversation and I'll make sure that I'm dressed appropriate for next time. Thank you, ladies.
Thank you so much. Thank you so much, Dr. Grace. Thank you, Malita. Thank you, Irene, for running the show. Thank you, Nelly, for producing the show. And I just want to say thank you to our team in Zambia for doing an amazing job without us. And over here, we have two new members. We have Sandra and Paul and Wupe, who's having fun over there with Nelly. Thank you so much. And Priska, enjoy the rest of the day because yesterday was your birthday. I know you're not feeling well, but we love you. Irene, take it up.
Oh no, I just wanted to say thank you, everybody, and happy Sunday, and stay safe.